Well, a woman dies of heart disease every 80 seconds in the United States. In fact, it is the #1 killer of women in this country. And interventional cardiologist Sam Tucker with Novant Health joins us now with more on the causes and symptoms of heart disease in women and what we can do about it. Good to see you.
Great to see you again.
All right, so now what are some of the causes of heart disease in women?
So heart disease has many forms, and those forms have different causes. It can include structural problems of the heart, which patients are typically born with, and then other conditions such as atherosclerosis or a hardening of the heart arteries, which is predominantly related to lifestyle choices. Now, structural problems occur in about 20% of the time. The vast majority of cases, approximately 80%, are directly related to lifestyle choices.
You got to make some changes, right?
Exactly.
So talk to us about what women can do to reduce their risk.
Well, it's the things that many of us have heard before, making sure that you eat a healthy diet, one that is low in fat, low in sodium, low in cholesterol, that you exercise routinely. We usually recommend 30 minutes a day, 3 to 5 days per week, maintaining a healthy weight, and then not smoking. You know, if a woman stops smoking, she will decrease her risk of having a coronary heart event by over 50%. Also, if you have chronic conditions such as diabetes or blood pressure, it's important that those get managed appropriately. And every person, even if you are practicing healthy habits, should get their blood pressure and cholesterol checked at least once a year.
All right, what about those warning signs that tell us something's going on?
That's a great question. So not all heart problems have warning signs, and the warning signs are different for men and women. For example, if a woman is having a heart attack, she may have a fullness sensation in the center of her chest. It may be described as a burning or a tightness. This pain may last a few minutes and go away and then come back, but oftentimes it's a more atypical presentation. It may just be some pain in the arm or the neck or the back or the jaw, exertional shortness of breath, or even just flu-like symptoms such as nausea and weakness. Those can be signs of a heart attack. And sometimes people don't recognize those as signs of a heart attack, and they might not call 911. So it's very important that you know the symptoms, and if you're experiencing them, that you actually act on it and call 911.
It doesn't hurt to have a heart guy living in the house with you, right?
Yes, ma'am.
All right, so where can people get more info?
So they can visit our website at novanthealth.org/GoRed to find more information about women's heart health and get a healthcare provider.
All right, fabulous. Thank you so much. We appreciate you.
You're welcome.